Alright, so this is going to be my medication checkoff video. Let's see how this rolls. So first we are going to start off by going through the 3 different sites of IM injections just to get it out of the way. You have the ventrogluteal site, you have the vastus lateralis, and you have the deltoid. The ventrogluteal site can take a 1.5 inch needle, and you should give them no more than 3 milliliters of medication. For the vastus lateralis site, that is going to be a 1 to 1.5 inch needle, and you will give no more than 2 milliliters of medication in there. And for the deltoid, dependent on how big the person may be, you would use a 1 to 1.5 inch needle and no more than 1 to 2 milliliters. According to our notes, it was saying 1 milliliter, but according to the book, I think it said 2, so somewhere in 1 to 2. All right, so just to look at all of the sites on the mannequin, we are going to start with our deltoid since it's up here. I'm going to move this a little bit so you can see. Oh, it's just going to be a big old struggle bus over here. All right, so in the deltoid, you are going to want to look for the acromion process, which is going to be somewhere in this little muscle right here around your shoulder. You're going to want to go since I have small hands, 3 finger width, and honestly it may just be easier to show it on me. So we have the acromion process right here, about 3 finger widths, and it'd kind of be like in that little site right there. Let's see if I can. So, acromion process, 3 finger widths, and then there's a little triangle that's like right in there, and so it'd be like in the middle of that triangle right in here. For the ventrogluteal, that'll be on the patient's hip. So you're going to take your hand, your palm, it's going to be on the greater trochanter of the pelvis. Let's see if I even have this right there. There we go. Okay, so the greater trochanter of the pelvis over here. The thumb is going to be leaning towards the groin. The pointer finger will be going towards the anterior superior iliac spine, and the middle finger right here will be going to the iliac crest. Honestly, yeah, I think I may have been doing it the wrong way. So greater trochanter, thumb towards the groin over here, pointer finger going up towards the iliac spine, and then the iliac crest is where this middle finger is going to be. It makes kind of like a V shape. I'm trying to show you. And then in the middle of that V shape, I don't even think it showed. Let's see. In the middle of that little V shape, I can't exactly point right there. That is where you would give your ventrogluteal shot. And let's see if you can see this. Okay. And then for the vastus lateralis, you would put one hand on the knee over here, one hand underneath the greater trochanter. You divide the thigh up into thirds, and that middle third on the anterior lateral portion would be where you give your shot. And it kind of looks like it is marked in here already, but I would say in this middle area right here. Alrighty, so those are the 3 sites for IM injections. Now I'm going to go ahead and move this around so we can grab all of our supplies. I went ahead and took out a couple of syringes as well as needles for when we will be drawing up the medications. But we are going to go into the patient's chart. We're going to pretend like I'm not even in the room right now. This is just where the computer happened to be, and it's closest to the cart, so I figured it'd be the easiest to start videoing at. All right, so when we go in here, you're going to be pulling up the patient's chart, Miss Chloe Crawford. Here, I may even, well, I don't know. We're filming on an iPhone, and they aren't the best at getting all angles, unless you move them a certain way. But okay, so we got the patient's chart pulled up. We are looking at her vital signs. You want, before you give the medication, you want to check her heart rate, her blood pressure. You want to check temperature, make sure she doesn't have any fever. You want to assess her pain level in case she's having any pain. And if she has pain medications, especially. And you are also going to want to look at her lab work. Alrighty, so we see her labs, white blood cell count, red blood cell. We'll scroll down. Okay, and then you want to get to where her glucose is, because the patient has 220 milligrams of glucose in her blood sugar, which means she's pretty hyperglycemic. So that is going to be what we will be giving her insulin for. So you just want to assess all of those before giving the medications. Now we are going to pull out these medications. We're going to go to orders and the EHR, and we have the influenza vaccine. We have regular human insulin. We have lisinopril and ondansetron hydrochloride, also known as Zofran, for nausea and vomiting. So we are going to look in our cart and get these medications out. So the first thing we are going to look for on here, I see, is influenza. So I see influenza over here. We are going to get this. We're going to compare it to the MAR. Perfect. We're going to make sure it is not expired. It says it expires January 2035, so we are good. So that is going to be influenza, and I'll just set it right over here next to one of the not insulin syringe. Next medication we have is regular human insulin. So we are going to come to the insulin side of the box. We have regular and NPH. It does not specify. NPH is one of the medications being given, so we will not be given NPH, only regular. And I'm going to compare it to the MAR here. Want to make sure that you can kind of see that. Perfect. We're going to put it next to our insulin syringe. Next medication is lisinopril. So we are going to grab one of these little lisinopril tablets. Set it over here. I have a cup, medication cup, and then a water cup with a straw for the patient to drink out of whenever I am giving her the oral medications. And then last but not least, we have ondansetron hydrochloride, and I see the label over here, so I'm going to take this out. I don't know if I compared my lisinopril to the MAR, so we are going to go back and do that real quick. My lisinopril, 2.5 mils, perfect. Technically expired in 23, but sim purposes, we're not worried about it. All right, and then ondansetron, Zofran, we're going to check that to our MAR and make sure it's the correct medication. All right, and we're going to set that right over there as well. And that seems to be all the medications we have for the orders. I have the pads for sub-Q and IM injections. I have alcohol swabs, as well as gauze for our injections, and I have the 3 labels created. I said IM injection. sure. That Odancitron. Let's see, I saw it earlier. Because I know one of those is our IV push medication. Okay. So the influenza is going to be our IM injection. Insulin is our sub-Q, lisinopril is oral, and then Odancitron is going to be our IV push medication. So I also have normal saline in here to flush the IV port, just to make sure nothing interacts. There are no incompatible medications left in the IV. And I would check if I needed information on certain medications, or I gotta squat down a little bit, or if medications were compatible, I would look in the Davis's drug guide. It's actually what I got used to prop my phone up right now while I do this video. Okay, so we are going to start. So I am going to perform hand hygiene before I draw up these medications. And let's see, I might be able to raise this a little bit. Like Dr. Farr, I'm going to say sorry for the big arm instead of big hand. So, all right, so we're kind of raised up a little bit over here. Okay, so the first thing we are going to do, I'm just going to move some of these to the side. I'm going to put this lisinopril in the cup over here. And I'll set this over here as well. So we are going to start, we're just going to go in order on here with the influenza vaccine. So I have the influenza medication right here. I'm just going to make sure it is the correct medication for my second check to the MAR, since you can't see, before we draw it up. Okay, so it says we need 0.5 mils of the influenza, so I'm going to open up my syringe, as well as a needle to drop the medication. And then you don't want to touch this, you want to keep it sterile, as well as the tip of this. So we're going to put those together. And then I'm going to set this just to the side, throw away our trash later, and then set this needle right over here as well. This video is probably going to be longer than 30 minutes, since it's 15 and I'm trying to get these medications together. Maybe I'm just not doing fast enough. I'm trying to talk through everything. So first we're going to get our alcohol wipe, and we are going to scrub the hub of this thing about 5 to 20 seconds. Just get it really rigorous. You want to make sure you don't have not pathogens, but bacteria and the nasties up in there. All right, cool. Scrub that. So we are going to unsafety our needle, uncap it. I'm going to go ahead and put this cap in here because you don't want to recap a needle. We are looking for 0.5 milliliters, so I am going to get 0.5 milliliters of air. We are going to inject it in here. Perfect. And then we're going to flip it up. And draw the medication. All right. And I like to get a little bit extra, just because, not a lot, just a little bit extra, just to make sure that I could get the whole 0.5 mils. So we've got 0.5 mils right there, I'll show you, but we are also going to push up a little bit, make sure we get all of our little air bubbles out. Perfect. We're going to recap that needle. and then 0.5 milliliters of the influenza. So we're going to set that right over here and then put the influenza vial back in. And we'll put our syringe with that just to keep everything together. All right, for insulin, oh, it's been 15 minutes already. For insulin, I went ahead and took out my alcohol wipe. Probably should have waited until I had the vial out already, but we are not going to touch this alcohol wipe to anything but the hub. Okay, so we're going to scrub that hub again. So sorry you can't see my face. Scrub that hub again. Really good. Boom. Set that right over there. We are going to take out our insulin syringe. Go ahead and toss that. We're going to uncap it. Okay. Then we need 15 units according to the MAR. Oh, we're going to perform our second check as well. So insulin, human regular, perfect. We need 15 units. So we're going to draw 15 units of air. And check that in. Flip it upside down. And Bob's your uncle. Not really. Okay. So we're drawing up 15 units. Okay. Ooh. Come on, honey. You can do it. Stay right there. Okay. And then for insulin, you are supposed to verify with another nurse or an instructor just to make sure that you have the correct dose as well as the correct insulin. So we've got our 15 units of regular insulin. Want to make sure that you can see that right there. Okay. All right, and then this insulin needle is going to be the only one that you recap. So we're going to put our insulin back in here along with the syringe. Keep everything in order. All right, listen, April. So we're going to keep it in the package just to do a third check at the bedside. But I'm going to check it with the MAR, make sure it's the correct dose, correct name, looks good. All right, and then last but not least, we have our IV push medication on Danzatron. So we are gonna take this out of the package, scrub that hub, and then I'm also gonna label all of these. I was supposed to put on the label after I drew up the medication. Slipped my mind, to be 100% honest, but because I do have each syringe with their respective medications in the bags, it's a label in itself, so I labeled the correct medications. Alrighty, so we've got that. Scrubbed our hub on our Zofran. We are going to take out our syringe, attach the needle. For our IM injection of influenza, we're actually going to be changing the needle because you don't want to use a dull needle. Alrighty. Tell I'm nervous, right? Okay. So we've got that scrubbed, that hub scrubbed. Pull this down. Danzatron, 4 milligrams per 2 milliliters, and her dose requires 4 milligrams. So we're going to be pulling up 2 milliliters of Zofran. So we're going to uncap, get down to 2 mils of air. There we go. Gonna go in here. slowly pull back. It's kind of helpful when the air goes in, because it kind of helps like pull it back for you. And then at the third check at the bedside, I'm just gonna make sure I have the correct amounts in every syringe and compare it to the MAR. Okay. 2 milliliters. Gonna push it up, make sure you get those air pockets out. Honestly, this kind of hurts your hand. Gonna recap that needle. All right, and then we're gonna, well, we'll go ahead and label now actually. So, ondansetron Crawford C, so that is our patient's name. Stick to the side over here. Put that in there together. Go with insulin. I'll stick that around. You can clearly still read everything. Oops. Last but not least, we have our influenza vaccine that we will also be labeling and tabling to the side. All right. Okay, so now that we've got that done, we are going to go into the patient's room. I was afraid that was going to happen. We're going to go into the patient's room and then start her medication. So I'm going to maybe put her right here. Yeah. Man, sorry for the big arm again. You can see my nice veins and whatnot. Kind of move it down a little bit. Okay, and then hope that doesn't fall. All right, so I'm gonna put my medications on my cart, as well as the extra syringe for when we give her influenza vaccine, Cinepro, water cup. Sorry, you probably couldn't even see all that. All of my medications, syringes, labels, oral medication, water cup, as well as gauze for the injections, alcohol pads, IV push normal saline, and then the sub-Q and IM injection sites. Alright, so we're gonna move back. We're gonna bring some hand hygiene with us and then get this thing started. Good morning, Miss Crawford. How are you doing today? My name is Victoria. That would not happen in real life, or it might. My name is Victoria. I'm going to be your student nurse. I'm going to start by performing some hand hygiene, especially after messing with all of those medications. All right, Miss Crawford. So I have a few medications to give you today. I have your insulin shot for your blood glucose level. It's running a little high this morning. I have an influenza shot, you know, gotta get those, especially around flu season. Just make sure you're not getting sick. I also have, I saw your primary concern for coming in was nausea and vomiting, so I brought you some ondansetron, otherwise known as Zofran, you've probably heard of, which will be given through to your IV. And I have some lisinopril for your blood pressure. I saw that blood pressure was about 160/88. So we want to try to bring that down a little bit, okay? All right, I have a couple of questions to start off. Can you tell me your name and date of birth? And I'm going to be looking at the wristband while she tells me and comparing it to the MAR. Chloe Crawford, birthday is 1/31XX is what she tells me. And then I'm going to compare the I'm going to compare the whole MRN, but especially at least the last 4. So we have 6511262. You're going to compare it to the MAR 6511262, Chloe Crawford 131XX. Alrighty, Miss Crawford. I do have one more question for you. Do you have any allergies? No, no allergies. Okay, perfect. That's what I have listed in your chart. I just wanted to make sure that was correct. Okay, so we are going to start off your medications. We're going to start with that blood pressure medication, okay? You ready? Are you able to, do you have any difficulty swallowing? Are you able to swallow for me? You are? Okay, good. So we're just going to sit you up a little bit, make sure you're a little more comfortable while taking this medication. Is that okay? Awesome. And you're not having any pain today, are you, Miss Crawford? No? Okay, good. Okay, well the thing's not working, but we're going to pretend that we sit her up, okay? So, I have the lisinopril, and then for our third check, we are going to look in that MAR, lisinopril, 2.5 mils, exactly what I have here. So now we're going to open this little baby up. Alrighty. Alright, you ready, Miss Crawford? I have your blood pressure medication. Good, and I also have some water for you to wash it down. Alright, that one okay? Good. Next, Miss Crawford, let's see. Oh, and then before I do that, I do have to scan, which, shoot. Well, we're going to go ahead and scan her armband. Good. Okay, got that scanned. And then I want to go digging through the trash, so I'm just going to grab a new lisinopril barcode. So we can put that in. Good. Alrighty, so we gave her, Miss Crawford, her lisinopril, made sure she was the right patient, had the right dose, and was given orally, made sure it was at the right time. Supposed to receive her medications at about 9, it's 8:41. Good. Right patient. Oral. And her BP, if I remember correctly, was like, don't worry about it. I'm pretty sure her blood pressure was like 160 or 190 over 88, but I don't want to incorrectly chart that, so I'm not going to. Alright, we're going to update that. Alright, next, Miss Crawford, we have your influenza vaccine. So we are going to be giving this intramuscularly. So this will be in any of your muscles, whether your deltoid, your ventrogluteal, or your vastus lateralis. Is there a particular place that you prefer for the deltoid? Okay, are you right-handed or left-handed? Left-handed? Gotcha. So we're going to scan that armband again, as well as scan, you probably couldn't see it, as well as scan her barcode for her influenza medication. And then we are going to put this back in with the medication and set it to the side just to get that out of the way, okay? So the influenza vaccine we need is 0.5 mils. So we're going to grab our handy dandy little IM pad right here. We've got 0.5 mils pulled up. Now we are going to apply gloves. You're going to apply those gloves or giving any injection medication. Just don't want to get any blood or body fluids on that puppy, you know. Okay. All right, so I have an alcohol wipe. I am going to rub from the center of her, where I plan to give her the injection, and move outward. I'm gonna rub it for about 5 seconds. Perfect. You're gonna let that dry. Of course, in the real world, you're gonna let that dry for this video purpose. we're going to go ahead and, well, it's kind of drying. Okay, so while it's drying, we're going to go ahead and replace our syringe top because you don't want to inject her with a dull syringe. Okay, so lean that back, unscrew this cap right here. Ooh, sharps container. Boom, you couldn't see it, but I did put in the sharps container. I'm gonna apply the new cap. Don't want to drop it on the floor, and then we'll discard this in the trash. All right, we're gonna pull that safety back down. I'm so sorry, I'm in the middle of still recording. Sorry. All right, we're gonna put that safety back down. And then here's for that IM injection. So for the IM injections, you want to hold it like a dart. So we're gonna use our dominant hand, go in 90 degrees, boop. We're gonna hold it with the non-dominant hand and push. Alrighty, we're gonna take that out, apply some gauze and little pressure. So I'll just recap this needle, and we're gonna set it to the side to discard later. Alright, how did that feel? Was that okay, Miss Crawford? Good, okay. Still feeling okay? Alrighty, I just wanna make sure you have no reactions to any of the medications today. Did also forget to mention, which is why I'm running back through, before you give those medications, you are going to want to check the site, make sure there's no bruising or tenderness or masses, and you'll do that by palpating before giving the injection and inspecting the area. Alrighty, so we gave her 0.5 milliliters. Of IV, and we gave it to her in her right deltoid. Okay. And then we gave it to her at 8:42. It was scheduled to be about 9. So we wanted to make sure that we have the right time, right dose, right patient for the right reason. But I'll go through all of that because I know I'm over 30 minutes already. Alrighty, lastly, next we have our sub-Q injection. So we are going to take out our insulin needle. Scroll back up to where we have the sub-Q over here. I'm going to scan that armband again, as well as scan this little thingy in here. Dr. Farrar, I see why your video was so long. You got a whole lot of steps to do though. Alright, and then we're gonna put this back in. Because at this point, I think I'm just gonna Alright, so we have our insulin injection. It needs 15 units subcutaneously to be given. So scheduled at 8:30, about the same time, hour before, hour after. So we're going to set this right over here. We're going to take our alcohol swab and we are going to rub that subcutaneous tissue again. I'm actually going to throw that away just so I can ask the proper questions. Miss Crawford, for your insulin injection, where do you normally get that at? In the abdomen? And did you get in the abdomen last time you were here? Okay, and have you been using that side a lot, or? Okay, just started? Okay, so we'll go ahead and give you another injection on the other side of your abdomen, okay? I am just going to look and make sure the site is good to use, make sure there's no masses or tenderness, okay? I'm gonna palpate right here. Ooh, can you see? Alrighty. Does any of that hurt? No? Okay. The site seems good to use. Back up. Now that we've made sure that her site is good, we're going to go ahead and alcohol. So we're going to start in the middle, go around to the edges for a few seconds. All right. For normal IM injection, also to backtrack, the Z-track method's typically used where you pull the skin back just so you have more access to the muscle. Did not do that for this. It is a pad. And, doesn't really. All right, but for the sub-Q, we're gonna let the alcohol dry. We are going to take our insulin syringe, uncap, I'm gonna set it to the side. You're going to want to pinch an inch of the sub-Q tissue right here. Maybe I'll even come a little bit closer. I'm just waving this needle around like it's nobody's business. So we got 15 units to go in here. All right, Miss Crawford, are you ready for me to give you your insulin medication? Okay, good. So I'm gonna go in at about a 45-degree angle. Put that baby in. Doing so good, Miss Crawford. All righty. And then if I had my gauze closer to me, put that right over there. Apply a little bit of pressure just to make sure no bleeding and stuff like that. Make sure all the medication stays inside. And then if she needed a Band-Aid, we would also apply a Band-Aid. Okay, so that seems to be, our subcutaneous injections. Lola, I'm gonna go ahead and chart it on here. Giving it the right time. She got 15 units. There's not a units button here. Yes, there is. The location is going to be in the abdomen. I didn't specifically. What's up? Yeah, I'm on the last thing, the IV push. I didn't specify which part of the abdomen I gave it in, but since we are closer to her right side, we are going to go with the right lower abdomen, right underneath we're by the belly button. So lower right. All right, and then last but not least, we have her IV push medication. So we are going to get on our alcohol swab, scrub that hub. And Miss Crawford, I'm going to give you your IV push medication. It is your Zofran for your nausea and vomiting. So I'm going to unclamp her IV. I'm going to scrub the hub really well. And we are going. I should have gotten my normal saline out before I started this, but now we are just going to make do. So I'm going to keep that on my hand. Side up. We don't want it touching anything and becoming not sterile. Pull this out. Trash over here. Okay, and then we're going to flush her IV to make sure it's patent. So we're going to attach this. We're going to give her about 5 milliliters. Normally, I probably would not reuse the same normal saline syringe just to make sure that don't increase any infection. So we're going to set that right there. Perfect. I'm going to set that in there. Grab one more alcohol swab. Okay, and also before you give IV push medications, check the IV site, make sure it looks good. Okay, and then we are going to go ahead and scan her armband, as well as scan the Zofran medication, so we can chart it. Okay, then we're going to take this little thing off since it's an IV push. We're going to attach it to the hub. And then you would look at the Davis's guide to see how long to push it for. For this one, we're going to be doing 10 mils. I'd say about 10 mils, 1 mil every 10 seconds. actually see a little bit of leakage coming from this IV. Unfortunately, because it is sim and I'm supposed to be doing medication checkoffs, I won't be replacing the site, but in the real world, I would check that whenever I was doing my normal saline flush, and if seeing that it is leaking, I would check the tubes for the IV site, and I would change the dressing. Alrighty, so that is the rest of that medication. I'm going to scrub the hub again before flushing the rest of the medication in normal saline, just to make sure it all goes through. And then we're going to give her the rest of that saline. And we're going to push in about the same rate. This may be a little bit faster. All right. Scan medication is not working for this patient. Ooh, and dense on this was. Okay, well, for some reason it's not letting me scan the Zofran medication, so I'm going to put it in manually. So she got 2 milliliters, so 4 milligrams. Alrighty. Sorry, I'm almost done, girl. Everyone's been behind. Miss Crawford, I'm just going to make sure you have no reactions to any of your medications. Are you feeling okay? I'm going to check our sites. Make sure they're not having any reactions. Okay, good. Alright, well, your meal tray should be coming up in a little bit. That should be helping to counteract the insulin I just gave you. Is there anything else I can get for you, Miss Crawford, or do you have any questions for me? Okay, good. Alright, well, I'm going to leave your Kala in reach, okay? Make sure that her side rails are up so she can't get out of bed and fall out. Alrighty. You're going to give her her personal belongings in case she needs it just while she's asleep. Alright, Miss Crawford, well, I'll be back to check on you in about 30 minutes to an hour just to see how you're tolerating everything. You have a good morning. We're just going to add this onto that video because I just went and clicked. And then after that, I would take my gloves off before leaving the room. Perform hand hygiene. And then we are good to go. So sorry that took so long. It is a lot.